So the peer review panel and now the MTP have come to the conclusion that the effects of radiofrequency radiation on animals in this particular study are real, that there were cancer effects in the brain and in the heart, but there was also a heart disease, a disease of the heart muscles called cardiomyopathy. There was DNA damage in the brains, and there was reduction in birth rates of animals. Put this all together, and when we consider back to the original objective of the study was to test the assumption that non-ionizing radiation, which radiofrequency radiation is, that the assumption being held widely at that time is that it could not cause adverse health effects because it did not have enough energy to break chemical bonds. Well, we now know that that assumption is wrong because of the multiple effects that were identified in the TP study. If we go back a little bit prior to that, the nomination for this study came from the Food and Drug Administration, FDA, and the reason that they nominated this was because the existing guidelines were based on protection from heating effects with short-term exposures, recognizing that this may not be protective from non-thermal effects with long-term exposures. So the FDA nominated to the NTP studies on cell phone radiofrequency radiation to provide the data that could be used to assess health risks to humans.
So the FDA has stated that they don't agree with the conclusions of clear evidence for the schwannomas of the hearts in male rats.
It's kind of a strange position to take, considering that the NTP studies underwent an extensive peer review with much discussion about the exposure system, of which the peer review panel was extremely impressed with how the study was conducted, and the finding of rare tumors in a study adds much credibility to the fact that it is a real response as a result of exposure to radiofrequency radiation. I'm not sure who this FDA person is, but the person who made that comment wasn't even present at the peer review to hear the extensive discussion. I believe there were some FDA staff members present, but they heard the discussion, and there's really no basis, as far as I could see, for them just saying we disagree. They have a right to disagree, but they don't provide any rationale, which is any substantive rationale for just making this disagreement. I think it was quite convincing among the peer review panel that the effects on the heart, the schwannomas, was a real effect. And in addition, there were also brain tumors, which was considered by the peer review panel to show evidence of carcinogenicity. So there's at least 2 sites in which the evidence was positive for radiofrequency radiation having a carcinogenic effect.
Did the FDA issue comments during the peer review or previous to or even after? I'm not aware of it, but I didn't know if they, being that they disagree.
At the peer review meeting in March, individuals were permitted to make statements about the NTP studies, and there were a number of people who did make statements, but I don't recall any comments actually from the FDA that impressed the panel to consider these results not to be clear evidence of carcinogenicity.
Mm-hmm. What do you think the FDA should be doing with this information?
Well, I think their objective was to nominate radiofrequency radiation to provide the basis to assess effects on human health, because there was concern at that time that it may not be protective. Now that the results are available, there's demonstration of the cancer effects, DNA damage, effects on birth rate, effects on heart muscle. The purpose then is to make use of that data and provide an analysis of what the actual risk is in association with exposure to radiofrequency radiation. And this is done by agencies all the time in terms of doing what's called a quantitative risk assessment. This would be to look at the relationship between the dose, exposure, and what is the level of exposure inside the animal, and the disease outcome, which would be the tumor response. If you work out that type of relationship, then you can assess what would be the risk under exposure scenarios, which would be different than the NTP exposures. This would be, for example, less hours of exposure per day, even lower exposure intensities. If you know the relationship between exposure or dosimetry and response, you can come up with estimates of risk. Remember, in an animal study in which 50 to 100 animals are exposed at each exposure level, you can't get an estimate of the risk of 1 in 100 or 1 in 1,000 or 1 in 10,000 or 1 in 100,000. The studies don't have the power to do that. In order to get an understanding of the risk, say for 1 in 10,000, you would need thousands of animals. So the NTP study, and this is true for all toxicology studies, you typically use higher exposure levels than may be experienced by people, and knowing the relationship, then you make estimates of what would be the risk under different exposure scenarios. FDA has done this. This is standard practice at the U.S. Environmental Protection Agency, California Environmental Protection Agency. This is standard practice by health agencies throughout the world.
And
I should mention also, it is the practice of the WHO, where they also, not the IARC. IARC does qualitative characterizations of risk, but there are WHO committees that also do quantitative risk assessments. And FDA nominated cell phone radiofrequency radiation in order to be able to assess the risk to human health. Now what they need to do is conduct that quantitative risk assessment, work out that relationship, and with that relationship in mind, then the FCC, which sets the guidelines for human exposure, could develop health protective guidelines.
You said that it's an animal study. I've seen on the news that it applies to rats, but not to people. What do you think about that inference, those assumptions that are being made?
Well, animals are used extensively by various programs to understand risk so that we avoid, reduce, or eliminate human exposures to agents which can cause disease. Remember, every known human carcinogen has produced cancers in animals when studied actively. Therefore, the use of animals is done so that we can understand risks and reduce risks to prevent the development of diseases in humans. In terms of cancer, there's a long latency for many cancers. And with animal studies showing a cancer risk, the advantages is that by reducing this risk, we may reduce the disease outcome, which may not show up for many years. In some cases, IR, for example, doesn't consider a agent to lack cancer potential unless the latency period of at least 30 years has been established.
Wow, I didn't know that.
Yeah.
So that's the International Agency for the Research on Cancer of the World Health Organization. You're saying would want to ensure that 30 years of exposure had been looked at before they knocked it off the list of it could cause cancer or it can't. Is that
correct?
What I'm...
Yeah. That's one of the factors, but that's a important factor with respect to disease latency. At least 30 years. And there are some instances in which latency longer than 30 years has been demonstrated.
You are retired now, but what was your work there?
Okay, I began work at the National Toxicology Program at the National Institute of Environmental Health Sciences in 1980. Most of the work that I had done until I retired in 2009 dealt with studies of chemical agents, understanding their toxicity and carcinogenicity, leading the effort on a number of long-term studies that were done for the National Toxicology Program. I was also involved in mechanistic studies to understand how agents might cause disease, and also pharmaco or toxicokinetic studies, understanding the relationship between the exposure, internal dose, and what happens to that dose in an animal model, and how it might relate to. So I retired in 2009, but I began looking at the issue of cell phone radio frequency radiation in the early 2000s.
It's being said that the radiation exposures were high.
The alternative to using higher doses would be to use much higher numbers of animals, tens of thousands of animals, to understand the risk. And you can't do that with every chemical or physical agent. For the NTP study, NTP studies are typically done with 50 animals per group. We tried to increase the power a little bit by increasing the number of animals per group to 90. That helps a little bit, but it still is inadequate to detect 1% risk. And 1% risk is not something which is acceptable. Mm-hmm. In fact, the Supreme Court was once asked, what is acceptable risk? Mm-hmm. And this was done in the 1980s for benzene. And the Supreme Court came up with an interesting conclusion. Said, well, if the risk is less than 1 in a billion, that's insignificant. But if it's greater than 1 in 1,000, that's very significant. Left a big range between 1 in 1,000 and 1 in a billion. But the Supreme Court indicated then risk greater than 1 in 1,000 is significant. We cannot, in an NTP study, detect risk at 1 in 1,000 when you have 50 to 100 animals per group. It's just impossible. Mm-hmm. The FCC has established guidelines for human exposure to radio frequency radiation. An important aspect of this is what is the exposure level within 1 gram of tissue in these guidelines. The unit is maybe a little complex to explain what is the specific absorption rate, but the value is 1.6 watts per kilogram. And in fact, if you look into your phone, cell phone, iPads, you can find under the issue of legal, what is the measured exposure from that particular device. The limit that FCC has established is 1.6 watts per kilogram. And we realized that we could not go much higher than that level because of the likelihood of developing a heating effect. So the NTP conducted preliminary studies to determine how much exposure can an animal tolerate without showing an increase in body temperature of 1 degree centigrade, because that was the basis for which the FCC developed this particular guideline on human exposure. We were able to show in the NTP studies that the rats could tolerate 6 watts per kilogram. The exposures that were used in the NTP studies were 1.5, 3, and 6 watts per kilogram. So you can see that these are essentially the same or slightly higher than the 1.6 watt per kilogram, which is the FCC limit. So when you talk about what is high, with respect to holding a cell phone and its antenna next to the head, the localized exposure is what is the important metric with respect to risk to that particular region. So if you hold the cell phone and the antenna next to your head, that is the region that receives the most exposure. The exposure to your knees and your feet will be very minimal. So it's that local exposure which is the appropriate metric for understanding risk. In the NTP studies, a number of preliminary workups were done and demonstrated that under the conditions in which these exposures were conducted, the localized level in the brain was essentially the same as the whole body exposure level, so that the 6, 3, and 1.5 watt per kilogram was essentially the same in the brain as the whole body exposure. And that then becomes the metric for understanding the disease outcome and human risk. So I would say 1.5 watt per kilogram using the NTP study is at the permissible level, the acceptable level by the FCC for localized exposure. 6 watts per kilogram is not that much higher. It's a factor of 4. In many cases, the levels of exposure from an animal study to a human study can be hundreds, factor of 100, not 4. So, but in the end, the important thing is to conduct the quantitative risk assessment, because that's what will tell us what is the relationship between exposure, which would be the intensity over time that leads to disease, and work that relationship out to determine what is the risk under shorter terms of exposure or less exposure, because a person may hold their phone away from their head and use it on speaker. A person who does that is at much less risk than a person who holds the phone right next to their head. As I mentioned, the doses typically are much higher because we cannot detect risk at the level of 1%. 1% risk, for example, if there's a drinking water contaminant, if the risk was 1%, that would be devastating. If 1% of the population developed a disease from a contaminant in their drinking water, that would be terrible. So what you try to do is expose to a higher level such that you can understand the risk at lower levels and characterize. And that's what the quantitative risk assessment would do. About my first message is the FDA needs to do their job. They asked for the study so that they could assess risk to human health. Now that the data is available, do that assessment and estimate what is the risk to human health. Even a small increase in cancer risk could have a serious health impact because of the millions and billions of people worldwide who use cell phones. But another lesson to be learned from this is that when this study began, the assumption was that non-ionizing radiation could not cause any adverse health effects other than by heating. We know that that assumption is wrong. So therefore, it makes no sense to make assumptions about other types of wireless technologies unless they are tested and shown with adequate testing to be safe. So the implementation of technologies such as 5G would be implemented under the assumption that it is safe. From the studies on the radio frequency radiation, we know that assumptions can frequently be wrong, and for the protection of public health, these assumptions need to be tested.
It actually, the FCC chairperson and the commissioner just said that they had looked over the research and that the public health agencies had reviewed the research and that 5G was safe.
I'm not sure what research they're looking at, but I know there have been, well, first of all, they haven't even characterized 5G. They haven't told us what are the frequencies, what are the power levels, what will be the human exposures to 5G. So not knowing what human exposures will be, it's very hard to say that that is safe until that type of condition has been studied adequately in animal models, which can be predictive of human risk.
You know, something else I thought was interesting, I was looking at the 1996 adoption of the guidelines, which are based on standards from IEEE and ANSI and a NIC report. But I noticed that they are based on animal data, that animal studies from the 70s and earlier were used to determine at what level was the thermal effect an effect. So, and they were animal studies.
Right. Yeah. So, well, animal studies are used during drug development. It's a way of obtaining information about an agent that we may not know it can cause an adverse effect before applying it to humans. And that practice should also be carried out for physical agents, especially now that we know radiofrequency radiation can cause adverse health effects.
Thank you so much, Dr. Melnick.
Nice to speak with you.
Did you know that cell phone, the one in your pocket, emits radio frequency radiation? As long as your phone's turned on, even if you're not talking or texting.
The American Academy of Pediatrics in over a dozen countries recommends reducing children's exposure to wireless radiation.
When using a cell phone, I always keep it away from my body. I use speakerphone or a headset like this. To stop microwave exposure, I put my phone on airplane mode and turn off Wi-Fi and Bluetooth function.
I hold the phone at a distance and make sure it's not touching my body.
Cell phones are not toys. Children's brains and bodies are still developing and are vulnerable to wireless radiation. Practice safe and responsible habits with yourself and your children.
When using the computer, I always try to make sure my connection is corded, not wireless.
Remember not to use your cell phone in the car. The phone works at higher power in metal surroundings and bounces around, increasing your family's radiation exposure.
For their safety.
For your safety.
Because children are more vulnerable.
Remind them. Remind yourself.
To limit your microwave radiation exposures.